Sometimes in the label of your medicine, especially tablet and capsule, you might see words like SR, IR, or MR. Let's really explain that in detail. The abbreviation SR could be sustained release, IR could be immediate release, or MR may be modified release. When you say immediate release, that means you take the tablet, you take the capsule, and the medicine will quickly start to work, start to produce an effect. There is no delay. And most of the tablets, most of the medicines you have, usually they work, they are like immediate release ones. Maybe the regular paracetamol. You can take many of the antibiotics, many of the pain relievers do work in such a way. They are fast release. When we talk about MR or modified release, they are slow release ones. You swallow the tablet, but it will take time, or the release is not immediately. So the medicine is really designed to be released slowly. So you should really ask your doctor, your pharmacist, on what type of tablet it is, whether it is immediate release or it is a slow release one. So the slow release one, based on the design, the way the drug is made, they are released slowly. They are released for some time, okay? So maybe if you are having a once daily blood pressure medicine or long-acting pain medicine, take for example morphine, you can have immediate release or slow release morphine. So the immediate release is just for quick relief, but if you have a chronic pain, then the slow release or modified release pain relievers will be much better. So it's okay, the difference is fine. Now, what is the home take message? If you are given either of these slow release or modified release products, the big thing you should do is never chew, never crush these medicines, because the way the drugs work is when they are taken as is. The moment you break them, you remove the polymer that covers the tablet. So that release phenomena will completely be lost. If you need more advice on how to take your prescribed medicine, feel free to have a one-to-one talk with me on the link in my bio. I do really provide medication review consultation. All medicines are not found as tablet or capsules. Some are also found as a form of powder. And as we started discussing in the earlier video, we've said powder is another form of a solid dosage form. Tablet, capsules, the same powders. And you find them in a form of sachets, okay? And basically, powders can be taken by being mixed with water. Or some of them you can see like baby powders, you can apply them on the skin, okay? Or like oral rehydration salt, you mix it with water. So there is always a reason why drugs could be found in a form of powder.
Pill,
maybe you have
it enters
seen
your digestive system and travels down the esophagus to the
powders
stomach.
in a bottle.
Once in
where
the stomach,
you'll be told
the pill
to add a certain amount of water
contents,
and to
which then get
reconstitute.
absorbed
That's
into the
also,
bloodstream.
they are called
The liver
powders
then
for
filters the medication
reconstitution.
and
So,
metabolizes it.
if we start with ORAs, oral rehydration salt, you need to really mix it with clean water, okay? And basically, it is still found in a powder form, in a sachet. You can also find it in a granule form, and it helps to treat vomiting and related dehydrations, okay? We could also have paracetamol in a powder form, which is very good as a pain reliever for children, okay? So you see now you can't give tablets or capsules for children, and before going to injection again, they might need to take the oral tablet. So you can be given the paracetamol powder in a sachet form. You need to tear and then dissolve it in a clean water. We also have a number of antibiotics, as I mentioned, like amoxicillin, azithromycin, as a powder for reconstitution. So again, you need to measure the correct amount of clean water and or then add it in the bottle to the correct label, and then you need to shake to dissolve the same powder in the water. You can have antacids, which are also in powder form, which might lead again to be mixed with water. So you can see that we have quite a number of varieties of powder. So which you might need either to apply on the skin or some topical powders, but most of the powder formulations need to be mixed with clean water. I'll see you in the next video. Some medicines look like powder, but they are actually granules, a big size, a bit, not like fine particles, but they are a bit different in terms of size, and they are called granules. So keep in mind, granules are just one form of solid dosage form, but they are made of a bit larger particles as compared to powders, okay? And they are basically designed to improve taste, to reduce irritation, and also to improve stability. And also some granules could also allow controlled release. Example, you can take, for example, the oral rehydration salt I told you earlier. You can find it in a powder form in a sachet. Also, you can have it in a granule form, okay, with improved flavor, improved taste. You can have some antibiotic granules, okay, which are given us in the form of granules, especially for pediatric preparations. So still the same is true. You need to mix it with clean water. The typical example you can take is amoxicillin with clavulanate granules are a good example. We have also azithromycin granules. We have antacid granules. So granules dissolve slowly and can be very gentle on the stomach, and that is a good thing, is like an antacid granules. Also, we have a granule category called as effervescent granules. These are granules that release some bubbles when they react with water, okay, and they will be easier to drink. Typical and good example we have in the market is effervescent vitamin C, effervescent paracetamol. So you can see we have powders, we have granules, okay, still solid dosage forms. The difference basically relies on powders being made from fine particles, but the granules with an added advantage in terms of masking unpleasant taste, easier to swallow. But in both cases, you need to dissolve them in clean water. So whether you are given tablet, a capsule, powder or granule, is very important to read the label, the instruction of the manufacturer on the product to know the appropriate way of mixing or reconstituting, the appropriate storage place of the medicine, so that you'll have your products being maintained throughout the duration of your therapy, okay? Storage of medicine is a big issue, and we'll talk about it in the upcoming videos. See you in the next video.